Hello students, in today's class we will be continuing with our justification series. I already made a few videos regarding explain why or justification type of questions. You can find the link in the description. In this video we will be discussing these justification questions. You will be having timestamps next to each justification question. So if you know already something, you can scroll to that timeline to get to the video. But I would highly suggest that please revisit all the question in order to refine your explanation. You might be missing out on something which you already know or which you already don't know, right? Now a big shout out to one of my students, Shomokanti Odhikari. He actually reached out to me and gave these all questions for him. He's a first year medical student. Needless to say, these questions have got critical information which can also serve you if you are an aspirating PG student, right? So for first year student, these are very basic queries, but these are very relevant. So I will start right way. So Methotrexate is used for anti-cancer therapy, right? This question may also be framed in another way. Methotrexate is also a competitive inhibitor. Basically, that question is also targeting the role of methotrexate as anti-cancer therapy. The explanation is very simple. Mind it, for any explain why type of question, you don't need to write pages after pages. You just need to explain the exact thing. What is the reason for that type of question to be framed, and then you will get full marks. And always, if possible, give a diagram. That may be a simple flow diagram, maybe a figure and arrow diagram. That is all what we need in biochemistry, right? So needless to say, this is the basic reaction of dihydrofolate reductase. So what does dihydrofolate reductase do? You see, folate is converted to tetrahydrofolate, and dihydrofolate reductase enzyme is catalyzing that step, and ultimately tetrahydrofolate is getting converted to DNA and RNA. I mean, DNA and RNA are synthesized from this TH4. Okay, so this dihydrofolate reductase is actually competitively inhibited by methotrexate. As simple as that. So if we cut down this enzyme, folate cannot be converted to tetrahydrofolate. Mind it, this is not as simple as it seems. Okay, if you want to score good marks, you can actually give the entire detailed reaction, but believe me, for making the examiner understand about your concept, this is enough. So tetrahydrofolate cannot be converted to DNA and RNA, right? And this is actually the principle that is used in anti-cancer therapy. What is happening in cancer therapy? What is happening in cancer? Cells are multiplying, proliferating. Cancer cells are growing at a very rapid rate. All right. So it means what? There is a rapid proliferation of DNA in the cancer cell. So if we stop that DNA proliferation, if we stop DNA synthesis, then cancer will stop. The growth of cancer will be stopped, and thus methotrexate, by strategically inhibiting dihydrofolate reductase, being a competitive inhibitor of this enzyme, serves as an anti-cancer drug. Okay, so even if it comes in viva or theory, it is as simple as that to make the examiner understand with these few lines. Next, we move on to the next question. Isoenzyme assay is useful in the diagnosis of myocardial infarction. My friends, this question may be served in different way. It may be served as a 1 mark question after a long question. It may come as a short note as cardiac marker, or it may come as a justification type of question. Needless to say, in all those questions, you need to mention 2 enzymes specifically for cardiac, as a cardiac isoenzyme. Number 1, creatine kinase and lactate dehydrogenase. Mind it, if you are writing a short note on cardiac marker, lactate dehydrogenase is not of that much importance compared to the other markers like cardiac troponin, right? And as well as SGOT-SGPT. But if specifically isoenzyme assay is mentioned in relation to diagnosis of myocardial infarction, you should mention 2 enzymes, number 1 creatine kinase and number 2 lactate dehydrogenase. And you need to mention all of their isoenzymes, what are the various isoenzyme components and where are they located. For example, for creatine kinase, we have got 3 isoenzymes, CK1, which has got the subfraction that is BNB 2 unit, CK2 that is creatine kinase 2, which has got MB fraction, and creatine kinase 3 which is present in muscle, and the subfractions are made of unit. You can obviously see in case of myocardial infarction, this creatine kinase 2 level will rise. Similarly, in case of lactate dehydrogenase, we can see the lactate dehydrogenase 1 LD1 isoenzyme is mainly present in heart. So if we consider a patient of acute myocardial infarction or even old myocardial infarction, I mean the myocardial infarction which has progressed since a few days after developing, still lactate dehydrogenase 1 being present in cardiac muscles will rise in serum. So if asked about isoenzyme, please mention creatine kinase, lactate dehydrogenase, mention all of the isoenzyme subtypes, where are they located. You can pause this video and you can take down notes, or you can even find this very basic chart in all of your textbook in the enzyme chapter, right? But please feel free to mention these two enzymes, and if you skip any one due to lack of time, you can skip LDH, but you must mention creatine kinase, because LDH is losing its importance as a diagnostic marker of acute myocardial infarction, but creatine kinase MB is of utmost importance. But if you have time, you must mention both of these isoenzymes. Thus, after mentioning, you need to write, thus isoenzyme assay is useful in the diagnosis of MI by isolating, if we can isolate the isoenzymes that are specifically present in the cardiac muscle, that is CK2 and LD1. Next, uncontrolled diabetes mellitus causes cataract. This is again very easy. You see, in case of diabetes mellitus, there is hyperglycemia. Why? Because glucose cannot be utilized. Either there is no insulin, that is in type 1, or there is insulin resistance. Whatever be the cause, insulin cannot be utilized, therefore glucose cannot go into the glycolytic pathway. Right, normally glucose is converted to glucose 6-phosphate and the normal metabolic pathways of carbohydrate metabolism, we all know that. But in case of uncontrolled diabetes, since glucose cannot be utilized in the normal pathway, it is diverted towards the polyol pathway. It is acted upon by the enzyme aldose reductase. Okay, so what happens? Glucose, when it is diverted towards the polyol pathway, it leads to formation of sorbitol. This sorbitol accumulates in the cataract, okay, and this causes increase in osmotic tension in the cataract. So increased sorbitol inside the cataract, increased osmotic tension, that what it leads to attraction of water molecule inside the lens. Okay, so increased osmotic tension inside the lens, and it attracts water. What happens due to that? The refractive index of the lens changes. It becomes opaque and hazy, and that leads to cataract formation. Okay, there is another explanation. If examiner is not satisfied with this, and if he asks, only if he or she asks you anything else you need to mention, then only then you can mention diabetes, uncontrolled diabetes mellitus also leads to increased oxidative stress, and that oxidative stress leads to formation of low lens glutathione, and that plays a role in development of diabetic cataract. Mind it, there is already aldose reductase induced osmotic stress that I already discussed. So main mechanism is formation of sorbitol via the polyol pathway catalyzed by the enzyme aldose reductase, that leads to accumulation of sorbitol inside the lens, that increases osmotic tension in the lens, attracts water, changes the refractive index, and leads to cataract. Okay. Next question, almost similar. Galactosemic patients are often associated with congenital cataract. For that, you need to know and mention the pathway of galactose metabolism. Okay, you see, galactose metabolism has got three important enzymes. Rather, galactosemia, the disease galactosemia can be expressed, or it can be is present when one of the three enzymes are deficient. Number one and the most important is galactose 1-phosphate uridyl transferase. The name you will find in any textbook. Okay, galactose 1-phosphate uridyl transferase. Next enzyme is galactose epimerase or UDP galactose epimerase. Okay, GALE is epimerase, galactose epimerase. And the third is galactokinase, GALK. So GALT, GALE or GALK. Okay, uridyl transferase, epimerase or galactokinase. These are the normal enzymes which utilizes galactose physiologically. But in case of galactosemia, either one or two or three of these enzymes are deficient. What happens then? Again the same thing. Aldose reductase enzyme takes over and galactose is converted to galaxitol. It is also known as dalcitol in some textbook. One and the same thing. So galactose is converted to dalcitol or galaxitol. Again it accumulates inside the lens. It creates osmotic tension, it attracts water, it leads to formation of abnormal refractive index, lens becomes opaque and cataract formation. Mind it, these enzymes are formed when the baby is in utero, even if the baby is not born. Generally, diabetes, what happens? We either develop diabetes. Generally, a very small baby having diabetes is extremely rare. It can happen, but it's very rare. Either diabetes is expressed when in childhood, in type 1 or in adult. So inborn cataract are not common in diabetes, but these enzymes are, the deficiency of these enzymes are extremely common even before the baby is born. So even before the baby is born, this aldose reductase, galaxitol formation, etc., everything takes place, and therefore the baby can be born with cataract, which is known as congenital cataract. So the mechanism is almost the same: aldose reductase, galaxitol, dalcitol, osmotic tension and lens opaque. One important thing to note is this pathway of galactose metabolism is known as Leloir pathway. It is very important for MCQ. Okay. We move on to the next and very interesting question. Patient with carcinoid syndrome may exhibit pellagra. Now what is pellagra? Pellagra is a disease which is caused by deficiency of niacin. You must read vitamin B3. In fact, for all the vitamins, you should know what are their active coenzyme form and what are their deficiency symptom and role in biochemical role, right? Over there, you will definitely read that niacin deficiency leads to formation of pellagra. It is a disease which has got multiple symptoms, 4 Ds, dermatitis, diarrhea, deafness, dementia, and even death, 5 Ds, right? What happens in case of carcinoid syndrome is, alright, now you should notice that niacin can be directly consumed through diet, okay, as vitamin B3, or it can be synthesized from its precursor, that is the amino acid tryptophan. Okay, it is a known thing that tryptophan is a precursor of niacin. Okay, it is converted to the product N-formylkynurenine by the enzyme indolamine dioxygenase. Okay. So remember, this is the indolamine dioxygenase. This is the first rate limiting enzyme. Okay, this is the first rate limiting enzyme. Indolamine dioxygenase. It actually diverts tryptophan to niacin formation, right? Tryptophan has got other fates also. Mainly, it leads to formation of serotonin, which is a neurotransmitter. Tryptophan is converted to 5-hydroxytryptophan by the enzyme tryptophan hydroxylase. Then it is converted to 5-hydroxytryptamine or serotonin by the enzyme aromatic amino acid decarboxylase. Okay, AADC, aromatic amino acid decarboxylase, which is serotonin, right? And again, serotonin is converted to melatonin, okay, by acetylation and then decarboxylation. We are not going into all those things, but mind it, serotonin is also important substrate of product of tryptophan metabolism. In carcinoid syndrome, what happens? This pathway takes over. There is excess production of serotonin due to a genetic disorder, due to a tumor that diverts tryptophan towards the serotonin pathway. Hence, what happens? It actually depletes tryptophan I mean, it pulls away tryptophan in order to synthesize niacin, right? And in addition to that, in carcinoid syndrome, since it is a cancer, it's a tumor like state, excess serotonin leads to vomiting, nausea, okay, and patient cannot eat. So there is dietary deficiency of niacin also. So neither patient can take niacin from diet, nor he can synthesize niacin from tryptophan, which is a normal precursor. Therefore, patient undergoes a deficiency feature of niacin, and that leads to pellagra. Extremely important. Okay. Anyway, you can treat this patient if somehow niacin can be injected into the system. There is rapid clearing of pellagra skin lesions. Okay, that is a thing you should know for future when you become experts when you cross first year, right? Next, similar question: Hartnup disease give rise to pellagra-like syndrome or pellagra-like symptoms. Okay, I have got a dedicated video of Hartnup disease where I have mentioned the mnemonic. You can find that in my channel. I will give the link in the description. But the mechanism is very similar. In Hartnup's disease, what happens? It's a defect where the kidneys cannot reabsorb neutral amino acids. Okay, so what happens? Neutral amino acids get excreted, and one of the neutral nonpolar amino acid includes tryptophan. And basically the rest is absolutely same. The situation where kidneys cannot reabsorb tryptophan are excreted, it leads to a situation where there is deficiency of tryptophan in the system. Okay, and tryptophan deficiency, as you can see, two products are produced from tryptophan. I discussed in the earlier, explain why. Number one, serotonin, and number two, niacin. So if you consider the whole Hartnup disease, then the problem of ataxia, neurological problem, can be explained by serotonin pathway deficiency. But here we are specifically asking, we are being asked about pellagra. So you need to say this, that due to tryptophan deficiency there is niacin deficiency in the system, and niacin deficiency leads to pellagra-like syndrome. So this is basically Hartnup's disease. Again, if you want to know the detail, everything, I have got full video explaining everything. Okay. Next, radioimmunoassay or RIA has got its demerits also. Okay, so this is a very basic question. Basically, we need to discuss what are the disadvantages of radioimmunoassay. Radioimmunoassay is a technique which was used in earlier days to assay various parameters, immunological parameters like thyroid hormones, prolactin, FSH, LH, all these things. Nowadays, we use ELISA. Okay. Of course, RIA has got its huge advantage. It is very sensitive. It can detect minute quantities of analyte. We are not going into that. Since the explain why asks specifically the demerits, we will discuss the disadvantages. So what are the disadvantages of RIA? Number one, it requires radioactive substance. So it is hazardous. There is radiation hazard to the technician or the student or the researcher who performs in the RIA lab. Again, since it requires radioactive material, we need special arrangement to store. We cannot just store it in the refrigerator. Okay, we need lead shield, protected area. We need permission from regulatory board, etc. So these are the disadvantages which we need to consider. Next, high cost of waste disposal. You cannot just throw radioactive waste in drain. It will be a huge environmental hazard. So we need to follow proper protocol after the assay is done to discard the waste product, which is a costly affair, right? Next, it has got a very lengthy counting time. You need to count one by one. Basically, I'm not going into the detail how it is performed, just mention this point, lengthy counting time. Next, if we want to automate this assay was of historical importance. It was done manually one by one, but in automating the assay means analysis of same thing over and over again, there is problem in automation. And the last point I would like to mention is we use extremely diluted reagent because it is strongly radioactive. We cannot give a huge concentration of the reagent because it will be a too much radiation hazard. So the reaction is extremely slow, and hence we need to wait a long time in order to get the report. For example, now you can get thyroid report in 2.5 hours or 3 hours. In RIA, it can take almost days, right? So these are the disadvantages or demerits of radioimmunoassay. Next, ascorbic acid helps in maturation of immature collagen molecule. Okay, this is a key step in collagen synthesis. If you are being taught about the protein chemistry chapter, of course you have been must have been discussed in class, but what you need to know is the ascorbic acid actually acts as a reducing agent. What does it reduce? It reduces iron. It reduces iron from Fe3 plus to Fe2 plus, right? So what is the use in reducing iron? Basically, this ascorbic acid with the help of iron catalyzes a very important reaction of hydroxylation. Very important hydroxylation reaction. What is hydroxylated? Proline is hydroxylated to hydroxyproline and lysine is hydroxylated to hydroxylysine with the help of the enzyme lysyl oxidase. Okay, some textbook may say lysyl hydroxylase. It is the same thing. Okay, if you are going for MCQ, you may be asked where are the oxygen atoms that are incorporated. Okay, because we are oxygenase or hydroxylase, basically we are incorporating one oxygen atom molecule, so it splits into two oxygen atoms. So one gets incorporated in the lysine bound to procollagen and one gets inside the succinate. Okay, so this is something about MCQ, but as a first year student you should mention the enzyme lysyl hydroxylase or lysyl oxidase, and it catalyzes conversion of proline to hydroxyproline or lysine to hydroxylysine. That's it. And this is a key enzyme that helps in maturation of collagen. And ascorbic acid itself acts as a reducing agent to reduce the iron from ferric to ferrous state, because we need ferrous iron to catalyze this reaction. Next, chaperone play a very important role in protein folding. So what are chaperones? You see, chaperones are heat shock proteins. Okay, so chaperones may come as a short note. So what happens normally when a protein is being synthesized? You know, it's a long amino acid chain that is synthesized as a primary structure. Thereafter it folds into a secondary structure, tertiary structure, multiple monomers combined to form quaternary. So basically there's a protein folding that goes on, which is very essential in order to gain the final functional state. Now you see, this three-dimensional protein may fold in multiple way. Okay, there may be multiple final conformation of a folded protein, but only one of them will have the desired biological activity, right? So what chaperones does? Chaperones help those proteins to attain that functional state which has got the actual biological activity, right? Basically this has been sorted out by nature. Originally it might have been so that nature saw that when a protein is getting synthesized, it is getting into multiple shapes and most of them are waste, and only few that are folded into a specific type of shape are being functional. So nature devises some control or a guardian who guides the protein so that they only assume that state which is actually functional. You can see in the diagram, an unfolded protein, it may spontaneously fold into abnormal undesired structure, or it may undergo some damage in order to form some abnormal folds. But if chaperone is present, it helps the protein to fold into the native structure, right? So how does it do? Chaperones actually attach to nascent polypeptide chains and they prevent wrong folding, so that the folding is allowed only in the correct direction. They help in the assembly of tertiary and quaternary structure proteins. So out of multiple possible wrong direction and a single possible right direction, chaperones shows the path. Okay, it hand holds the protein so that the folding only occurs in a specific direction, right? Actually, the word chaperone, it's a fun fact, it means elderly lady in charge of an unmarried girl on social occasion. You know, please don't be offended anyone. It's viewed that unmarried girl on social occasion, it was viewed ancient times, it's not my word, how the patriarchic society came with this nomenclature. They were of the opinion that unmarried girl on social occasion may go here and there, right? So somebody, elderly lady, needs to be in charge in order to control them so that they go perfectly towards the intended, I mean, who, maybe to the guardian. Anyway, so, and you should know that abnormal protein folding in absence of chaperone or any damage to the chaperones, heat stress, etc., will lead to abnormal protein folding, and those are known as prion diseases. Next, lipoprotein lipase deficiency may give rise to hypertriglyceridemia, right? So this is a classic example of you need to mention what does lipoprotein lipase do. There are a few justified type of questions where you need to mention what is the normal process, and then you need to mention the deficiency give rise to what problem, right? So we need to know about lipoprotein lipase. So this is basically, this is for MCQ. Okay, lipoprotein lipase is a enzyme with actually whose if you want to know the chemical nature, is actually triacyl glycerol acyl hydrolase. Okay, it is a water soluble enzyme, again an MCQ point. For first year student, what you need to know is they hydrolyzes triglyceride. They break down triglyceride into what? 3 fatty acid and 1 monoacyl glycerol molecule. This is what is happening if the enzyme lipoprotein lipase acts on TG or triacyl glycerol. Okay, 1 monoacyl glycerol and 2 free fatty acid. Again, I mean, this will again break down into 1 MAG monoacyl glycerol and 1 free fatty acid, right? So what happens normally, this enzyme helps in uptake of chylomicron remnants. What are chylomicron? Chylomicrons are food particles that are formed when we ingest fatty food. Okay, they are rich in cholesterol, they are rich in triglyceride, and for that we need, I mean, the enzyme lipoprotein lipase requires ApoC2 as cofactor. All these things you need to mention or you need to know. In order to know the deficiency, you need to know what is actually happening. Fine. Then you need to mention, without this enzyme the body cannot break down the fat that is digested from food, and hence chylomicrons build up in blood, and that will lead to conditions which are known as one of the 3. The question may come as hypertriglyceridemia or hyperchylomicronemia. Previously it was known as hyperlipoproteinemia type 1. That is familial hyperlipoproteinemia type 1. Okay, so this is how you need to tackle this question, and we have explained all the 10 questions. Feel free to go back and scroll to any question that you have missed or you have not understood. And thanks for listening. Please feel free to reach out with your question in the comment section. You can join my Facebook group, the link of which is also given in the description. You can mail me with any query, but please know that all of these questions are very essential for you in order to attempt, I mean, in order to go for Viva or theory exam in your first professional MBBS, or even if you want to answer MCQ question for PG examination. I have got multiple more such explain why type of videos. You can feel free to browse in my channel. I will also give the links in the description. So I thank you all for your patient hearing. I'll see you soon with another video. Till then, bye and take care.